I've been writing articles about colorectal cancer awareness, and I introduced you to a patient of mine named Sandra. Well, that's an alias name. Sandra now wants to come forward and share her story.
My name is Isabel David. I'm 52 years old and I'm a dentist in Encinitas, California. At 50 years old, I was diagnosed with colon cancer.
Isabel's been a patient of mine for years, and a year before she got diagnosed with colon cancer, she came in for her well-woman exam. We discussed colonoscopy, and I recommended for her to go, but she felt so good and healthy that she thought she'd just put it off for about a year. Normally, we recommend a colon cancer screening at age 50, unless you have a family history that might make it earlier. What's interesting is now we're seeing cases of colon cancer in men and women in their 20s and 30s. Even though screening is recommended at age 50, if you're experiencing any symptoms such as nausea, vomiting, bloating, a change in your bowel movements, or rectal bleeding, please call your doctor and be evaluated.
I took myself to the emergency room because I was having rectal bleeding for a week. The bleeding that I saw was pretty heavy. I saw literally blood clots, and prior to that, in the last 6 months, I started having a lot of pain while I was going to the bathroom. I felt tired, and mostly I started having a pain on my lower left side every single morning, like around 6 o'clock in the morning, which the pain was alleviated after going to the bathroom. I thought that maybe I was gluten intolerant. I did some research. I'm trying to find some better nutrition. I always ate healthy, but I was even more at this point more careful of what I was eating. I was going a lot more to the farmer's market. I was getting my granola. I was juicing. I was doing everything possible to feel healthy.
Don't disregard gluten intolerance or lactose intolerance, because those symptoms may be true, but it may be a signal of something else more serious going on.
I was working in my office and I saw blood clots in the bathroom, in the toilet, so that really scared me and made an appointment with a doctor. I still didn't make it as a priority. Right before that, I started noticing that my stool was different. And I was having pain, and the bleeding had consistently been happening through that whole week. So I called my doctor and I asked him if he thought that it would have been necessary for me to go to the emergency room. He considered that that was probably a good idea. I stopped to eat some food before because I never lost my appetite. And like around 7 o'clock at night, I went with my sister to the emergency room. I offered to give them a stool sample, and it came positive with occult blood in my stool, and they suggested that if I wanted to do a CAT scan. I said, absolutely, let's do a CAT scan. I saw the results right away, and I was very concerned right away when I saw them, because one of the differential diagnoses that they were giving me was neoplasm of the colon, and the other one was chronic diverticulitis, which I knew that I didn't think that was going to be the case. I never had any problems with diverticulitis in the past. So after the results of the CAT scan, and because we were concerned with diverticulitis, the doctor let me go home with some antibiotic and a promise that I will see my gastroenterologist as soon as possible for a colonoscopy. I was able to get an appointment with the gastroenterologist. I brought with me the CT scan, the copy of the CT scan to that appointment. We both sat down to see it. I remember seeing his face, and I could see that, there was something that it was not okay, obviously. I was very concerned because in the CAT scan also was saying that I had some lymph nodes in the area that they were alterated, they were calcified. So the colonoscopy was done. Unfortunately, I think that the colonoscopy from the beginning gave us a signal that something really wrong was happening. I remember the doctor at the end of the colonoscopy letting me know that it only lasted like 10 minutes because he was not able to fully go through the full extension of the colon because there was a mass that was obstructing. And he let me see the pictures. I told him, I said, I know you probably don't want to tell me, but I'm also able to recognize a mass when it's benign versus one that is not. And what I saw in the pictures from my colonoscopy, it looked like an ulcerated bleeding mass, and I know that doesn't look good. So I was the one that told him, I said, I know that it's cancer, right?
There are multiple screening tests for colon cancer. It's important that you discuss with your doctor what's the best test for you.
I asked him what stage he thought it was going to be, and he said, well, I think it's probably going to be between 2 or 3. I guess I cried a little bit, but not too much actually, because I don't know, I just knew that it was going to be something that I was going to have, it was going to happen, but I also knew that I was going to be okay at the end. I had the surgery, a tumor was removed, and 12 lymph nodes were removed of the area, anything that looked compromised. The next day, the surgeon came to my room, and that's when we knew that it was definitely a stage 3. It was with the first doctor that I interviewed, the one that told me about how many cycles I was going to be requiring given the stage of my cancer, which was going to be 12 cycles. He also mentions that they were recommending for my convenience to also have a port placed in my chest, and also what the possible side effects would be of the medication that they were giving to me. One of the drugs that they were suggesting is oxaliplatin, and one of the side effects is neuropathy and inability to touch, inability to feel. You could lose your fine touch. And I remember that's probably the second time that tears came in my eyes, because I told him, I'm like, I am a dentist. And you're telling me that this could be affected. And that was it. That was a very scary thing for me to hear. This type of dose that they were giving me, the oxaliplatin and the FU, is what it's been proven the most at the time to get the best results. The other one was an alternative, but then there is less risk, and we're talking about, small percentages that represent your life. Within a month, they started chemotherapy. They also prepare you for antiemetics to help with the post effects of the chemo, to help with nausea, and also they give you a medication that is going to help you to keep more the energy levels up. I did feel nauseous, but I never had to vomit. Your appetite definitely gets affected. The taste of your taste buds change constantly. Food doesn't taste the same. For me, having oxaliplatin, one of the effects that it has is you're very high sensitive to cold. I could not tolerate anything that had ice. I could not touch anything that it was cold. And then you have the taste of metallic in your mouth. My brain felt very foggy, and I could dedicate just 5 minutes of reading something, and right away I I felt like, I didn't have the capacity to absorb all the information. And that was very scary because I was like, is this ever gonna go away? Am I ever gonna feel myself again? So I started losing my hair. And at the end, I decided just to remove it all. And actually, to tell you the truth, I actually did not mind to be completely bald. I think I like it. It was a different look. And once again, I tried to take everything into, I'm alive, I have hair, and now I have a new hair. It came out all curly. I didn't have curly hair before, but it's a new me, which is a new me that it comes together with what this experience had brought into my life and into the people that were around me. One of the most important lessons that I would like to pass into others, please listen to your body. Don't disregard signals. Changes in your bowel movements can represent something more serious. So don't just think, maybe I'm just intolerant, maybe I have lactose intolerant. It could totally just be that, but please talk to a doctor, and whatever you do, stay positive.
If Isabel has taught us anything, regardless of how well you feel or how good your diet is, please go in for a screening test by age 50.